Good morning. I am Hrishikesh Kumar, Movement Disorder Neurologist from Kolkata, India. And today is 29th of August 2023. I am interviewing Dr. Pramod Pal, Professor in Neurology, National Institute of Mental Health and Neurosciences, Bangalore, India. We are here at the 2023 International Congress in Copenhagen, Denmark. Dr. Pal, great to talk to you.
Yeah.
Now let's start your journey. Could you tell us about your early years? I know that you started from a very small sleepy town of Durgapur. Can you tell about your early education and early growing up?
As you said rightly that I am from the eastern part of India and a town called Durgapur, which is a steel city. And I did my up to 10th we did in St. Xavier's Durgapur, the school. And later on I moved to Calcutta St. Xavier's for 2 years. And subsequently, I did my MBBS, that is medical degree, in Calcutta Medical College. That is one of the most old medical colleges in Asia. Subsequently, I went to Postgraduate Institute of Mental Education and Research, that is PGI-MIR in Chandigarh, where I did my post-graduation in general medicine, internal medicine. Following that, I moved to the National Institute of Mental Health and Neurosciences, where I'm working. I moved there to do my residency in neurology. This is called DM. And following that, I started my so-called as a career in the academic field or as a academician. And initially, I went to a small trust hospital called SWIMS, that is Sri Venkatesh Institute of Medical Sciences, in a small town in southern India called Tirupati. So there I worked for about few years, and then I got the opportunity to work with Dr. Donald Khan in Vancouver and do the Movement Disorder Fellowship in 1997 to 99. Following that, I returned to India and joined as a faculty in the same institute, that is NIMHANS, on 1st of January 2000. And from that time, I'm here in this institute. Subsequently, I had some more training in electrophysiology and transcranial magnetic stimulation in Toronto with Dr. Robert Chen from 2002 to 2003.
That's wonderful. When I go back to the history again, when you're doing MBBS in India or doing graduation in India, neurology is very tough. Neurology is supposed to be one of the toughest sciences. So what made you bring towards neurology, neurosciences, and movement disorders?
Okay. So what made me take medicine also, I really do not know, but probably my sisters were in the medicine, so I took medicine. And I never, looking back, I never think that I would have taken any other line except medicine. Yeah. So I was fortunate to work from the third year, that is the clinical, when we started the clinical rotations during the MBBS with Dr. Bhaskar Raichaudhuri. And he was one of the pioneers in neurology in India. And I really liked the way he used to analyze the history as well as localization in the nervous system. I think that is one of the most interesting and most challenging. So it made me, look towards that it will be neurology will be my profession in the future. And that's why I wanted to do neurology. But that time, there was no, I don't think there were any direct courses to go for neurology. So internal medicine was the first stepping stone and followed by neurology.
Wonderful. At present, you are a mentor of mentors. But when we go back again, during your growing up period, I'm sure that a lot of mentors affected your career. They influenced you. So can you tell some names that made you what you are today right now?
So as I told you that in my medical school days, Dr. Bhaskar Raichaudhuri was one of the mentors for neurology. And subsequently, when I went to PGI Chandigarh for doing my general medicine MD, there we had the option to do whatever dissertation you like. So I chose to do in neurology. And there I don't think we had any option for movement disorders, but I approached Dr. Upinder Dhand. She was one of the very good neurologists at that time. And my first dissertation was in vincristine-induced neuropathy. Okay. But I liked the way she, groomed me for doing a research. I used to take the patients of Hodgkin's lymphoma who was taken vincristine before and after I used to do the electrophysiology. So primary interest actually was in electrophysiology for me. And subsequently, I also came into contact with Dr. J.S. Chopra, who was one of the doyens in neurology in India. And subsequently, when I opted for doing a DM residency in neurology, I had the opportunity to work with Dr. A.B. Talley. So he was one of my mentors when doing DM in neurology. And in the context of movement disorders, I chose to do spinocerebellar ataxias. That time I did a dissertation in ataxias, but there was nothing. There was no MRI, no genetics, no artificial intelligence. And I studied about more than 100 patients of cerebral ataxia. But why I chose ataxia? Because I think movement disorder was, I never heard the name of movement disorders, maybe only ataxias I heard that time. And Dr. N.H. Wadia, who inspired me a lot, because he had a lot of work in movement disorders, as you all know, and he was the person who describes spinocerebellar ataxia type 2. So that time we knew only about OPCA, Friedreich's ataxia, and nothing else. So these were the few people who influenced me before I went for movement disorder fellowship. Yes, I wanted to do actually movement disorder fellowship with Dr. William C. Kohler, who is no more, but he was working in tremor. But unfortunately, I was not able to get a visa for going to USA, and so they thought me as a potential immigrant and not come back to India. So that was the reason which I could not do residency or fellowship with him. Subsequently, the two main persons who influenced me was Dr. Donald Kahn, who is one of the greatest doyens in movement disorders in the world, and also Dr. Stossel and Dr. Choi. And subsequently, Dr. Robert Chen, who inspired me. Along with that, Dr. Mark Hallett, who wanted me to do some electrophysiology as well as learn the TMS. That time in India, there was no concept of TMS, electrophysiology, etc. So maybe these are the main persons who influenced me in my long journey in movement disorders.
Those are amazing guys. We all know what your contribution is. I can tell you that MDSI was his brainchild. But if I ask you, when you look back, that what you feel that your most significant contribution towards this field in India and abroad?
Yeah, so significant contribution starts with, it started with my fellowship. So one day when I was in Vancouver, Dr. Khan asked me that, Pramod, why don't you do something for drooling of saliva in Parkinson's disease? There's no treatment for that. Then he wanted me to do something in radiotherapy, but I told I'm not interested in radiotherapy. So I came out, I read one article which was actually published by Bushara, I think in Medical Hypothesis, that botulinum toxin can cause dryness of mouth, because in botulism you get dryness of mouth. So that inspired me. I went to Khan, he said that no one has done this work, so we have to try out the dose of botulinum toxin. And that time I have never injected botulinum toxin. So I approached Dr. Choi, who is one of the pioneers in using botulinum toxin. He was also skeptical. Then we both of us, we tried to dig out how to analyze, how to see where we need to give the injections, what is the structure of the salivary glands. And then we embarked on a research project of start trying out botulinum toxin, intraparotid injection of botulinum toxin, and that was really worth, the project was worth, and it definitely showed good results. And that was one of the first publications in the world which we advocated giving botulinum toxin, intraparotid injection of botulinum toxin in Parkinson's disease.
Great.
Yeah. So that is the research area. Subsequently, yes, I think after I came back to India, there was no, there were only few movement disorder specialists. But when I joined in NIMHANS, there was only Dr. Uday Muthani was working in movement disorders. So I thought that let me focus on building up a movement disorder unit at NIMHANS, and I started with the clinical as well as the electrophysiology and TMS. So I did a lot of work. I think that was not done in India, about seeing the effect of transcranial magnetic stimulation on dystonia, on different Parkinsonian syndromes, and to correlate with the functional imaging, etc. And that is one of the things which I think that it had contributed a lot in the movement disorder area. And I realized that if you have to build up a base in India, so that was a point of no return. So I never wanted to go back. So I thought that it is better to build up a team. So when we build up a team, we realized that we have got mentors, but we need mentees. And the fellowship program, like that time in India, it was very difficult for people to go for fellowship outside India. The fellowship positions were very few, and the cost was prohibitive to go and sustain outside India. So then we started the fellowship program, I think way back in around 2014 in NIMHANS, I started the fellowship program in movement disorders. And then in India, 2-3 places it started. And subsequently, you know that I wanted to go back to the national area where we started you were one of my main colleagues, to start the Movement Disorder Society of India. So this is the way I think my contribution goes mainly in starting and consolidating the movement disorders in India. Yeah.
And I vouch for that. I know that you have done that and done that beautifully. But when you go back again, what are the challenges you faced while building up movement disorder in India or building up science in your place? Movement disorder science.
Yeah, so there is any specialty or subspecialty what you want to develop is built on 3 things. One is the therapeutics, how you take care of the patients, bringing the latest knowledge as well as the diagnostic as well as the therapeutic services for the patients. Okay, so that time I realized that before I went for movement disorder fellowship, hardly I saw in 1 or 2 patients of Parkinson's disease. So the awareness was not there. So building up an awareness among our colleagues, among our students, what is movement disorders? So that was lacking. But soon with few of my colleagues like Dr. Rupam, Dr. Mohit Bhatt, Asha Kishore, we started doing small courses in botulinum toxin, etc. And so awareness and building up the field, that is one of the things which was really challenging. We did small video rounds, etc. And Mandar Jog also helped a lot when he came to India. So this is one area. Second thing is that manpower development. So manpower development was again in the infancy, and we realized that only few of us who went for fellowship came back to India. The rest stayed back outside India. So we wanted people to come back to India, and they developed their own centers and develop the fellowship programs. So that was not happening, but now it is happening. And then the funding. So funding and national and international collaborations, that were also quite challenging for us. Funds, still it is a challenging. So, but now I think we have a lot of international support, national support. So that is no more a problem. Yeah.
So throughout your career, be it studentship, be it your teaching career, did you face any bias, personal bias, and you're allowed to speak up your mind if you want?
No, you think in the national or international?
Anywhere.
No. So I never faced any bias in India or abroad. Maybe my aspirations were very less. So that's the thing maybe. And when you are not competing with other people, I think the bias doesn't arise. Okay. And so when I went outside India, I felt that there could be a lot of discrimination, bias, etc. But I was very lucky to be, the first time when I went outside was in Canada, in Vancouver, and Dr. Donald Kahn was almost like my father, and he gave, and it was a very, very homely atmosphere. We never felt any, that I am not from Canada. So he made our life very easy, and he, along with his wife, Susan Kahn, who was actually the nurse in the neurodegenerative disorder centers, Dr. Stossel, Dr. Choi, they were all wonderful people. And we never faced any discrimination, any bias.
Great words. When you go back, say 20 years back, and you have to redo your life, what change you like to do when you have to relive your life, academic life again?
So 20 years back means the time when I joined as a faculty
exactly.
I don't think I would have done anything, because I am in one of the best centers in India, and I don't think I would have changed my life in any way. Okay, maybe if I had got the opportunity to work with some more collaborators internationally as well as many internationally, that would have helped me. If we had got some more grants from outside, that could have made our awareness as well as our the manpower development easier. So I think the funding opportunities and grants were the main stumbling block for us, but I wouldn't have changed my life at all or my ambitions. And what I've done, I think, is one of the best things which I could have done in the scenario. So I have now divided into the movement disorders, because I am working in 99% in movement disorders. I have divided. I have a very good colleagues as well as mentees who are working with me. And I focus in 3 areas. One is the clinical movement disorders, another is the electrophysiology in movement disorders, and including the sleep and the genetics and in movement disorders. And I am very fortunate to have 3 dedicated junior colleagues who are looking after those things. So once you build up a department, once you build up a specialty, whether at NIMHANS or nationally or internationally, you would always like that. See, nothing is permanent. So you would always like that this should be carried forward by somebody. It should not be the end. So that is the most important thing. I believe that you should groom, you should train your juniors so that they carry forward. Okay.
That's great. One question comes to mind as I'm talking to you, that in India, the first priority is seeing the patient, and a lot of patients, hundreds of patients literally. So how do you get time for research, studies, and family also? How do you manage life and work balance?
See, since I'm not in a private setup, we do not do private practice, so that is one way I have a lot of time, I feel. Okay. And yes, in the initial 10 years, I think, of my 23 years career in NIMHANS, we did not have too many people to look into that, and that time I did not find much time. But now I think we have a good setup, and seeing the patients, we have a lot of residents, fellows, and junior colleagues who help us in clinical workup of the patients. And when you have PhD scholars and DM residents, time is not a factor for doing the clinical work. But yes, what you told about how I get time for doing advocacy, or time for spending time for MDSI, spending time for MDS AOS, spending time for as a chair of the education committee, we need time. And I think after the office hours, if is anything called office hours, we use the rest of the time till 11 o'clock, 12 o'clock in the night to continue with that. About the family, how I get time for the family, see, I do not discriminate, or I do not differentiate between something which I am going to do after 10 years or after 15 years and what I am going to do in my productive years. It is not like that. So traveling is my hobby, gardening is my hobby, photography is my hobby. And I think that a good balance between all these things is needed actually before you retire. It is not that I'm going to keep these things after retirement to have to. So I have done plenty of traveling with my family in different places in India, outside India, and enjoyed. Yeah.
That's great. You talked about a hobby. Quick word about your family. How is your family, and how they have helped you to reach where you are right now?
Yeah. So my wife is she's a computer professional, and she has always supported me, and especially her knowledge. Actually, the initial days I never knew what is to work on a computer and all when we were residents, and she had definitely supported me for that, and she has always accompanied me for my international ventures, etc. And I have one daughter, and she is now doing the medicine, general medicine MD, and she's always supportive of whatever we do, the academic areas and all. And they also love traveling and also love photography. I mean, in fact, my daughter does more photography than me now.
So they share your hobby, and
yeah, share my hobby.
That's great.
We're in the same state of mind. Yeah.
That's great. That's great. Now you have seen the world changing. You have seen the movement is changing, and with the advent of new technology, you talked about computers, AI. So what do you feel, where the field is headed towards? Is it good, or it's heading towards something dark?
You see, as long as we keep touch with the patients, the clinical touch with the patients, and do other things, that is quite okay. Okay. So, but the problem is that the clinical touch with the patients, see, in movement disorders, I feel that you need to spend a long time in observing the patients, apart from the clinical history, observing the patients, following up the patients, see the treatment, side effects, profiling, etc., talking with the patients. So these are very important. So these are gradually waning off from our students, from our junior colleagues, etc. And that is quite alarming, because artificial intelligence is not going to teach you these things. Okay, we have seen that so many times. You give the MRIs, artificial intelligence will tell it's a PSP or it's a Parkinson disease, etc. But I think that is more of a hype, and we have to first have a good clinical training, and that should not be at the cost of promoting artificial intelligence. Genetics, yes. The genetics has, now there's a genetic revolution everywhere. Everyone is wanting to do genetics. That is, in a way, it is good. But after you, clinically phenotype, and then only the genetics should be done. It is not that you see a patient and immediately ask for, say, genetics. Okay. So these two are things which are very good, but I am not very sure about the artificial intelligence, because it may help you to write some papers like correcting the English, etc. But I don't think it can replace what we are. Okay. It cannot replace that.
So you're still hardcore clinical neurology is your forte.
In the field of imaging, maybe artificial intelligence may be a different issue. But for us, in our profession, what is chorea, what is tremor, what is dystonia, artificial intelligence, unless we feed the computer, they will not know these things. Okay.
Now coming to the future, your future, you have been workaholic. We know that. Do you look forward to retirement, or you'll keep on working till you drop?
See, there's an official retirement in our institute, so it will be done, and I think another few years I'll retire. Okay, but I'll definitely continue with my, the professional interests and hobbies. The professional interests include seeing patients. That is one of the most important things. Wherever I get an opportunity, either in a teaching hospital or a private hospital, I'll be definitely associated with movement disorders. And in the same time, I will continue my work in the Movement Disorder Society of India, as well as other areas in movement disorders in India. And now at least I have a lot of work in MDS. Now I've just taken over as the chair of the Education Committee. So I have a lot of things to do, and a lot of committees, study groups, etc.
Wonderful. We'd like to see.
And I will continue grooming people,
Yeah,
whether it is officially or unofficially, it has to be done. Yeah.
Wonderful. We'd like to see you working for a long time to come. One last question, then I'll let you go. That people who are entering the field of movement disorders, Parkinson's disease right now, what message would you like to give to them? And you can speak few lines about that.
Yeah. So I think again, it goes back to what just recently we have launched from the Education Committee, the career development. Okay. Now the youngsters who are coming, they should. One thing is that after neurology, it is difficult to decide whether you are going to take movement disorders, you are going to take epilepsy, you are going to take stroke. And so I advise them that first few years after completing neurology, you just see and attend all the meetings of epilepsy, stroke, movement disorder, etc., and decide which area will inspire you most. This is number one. Okay. Movement disorder is such a good area where you have both therapeutics as well as research, etc., which is not there in many of the disorders, like neuromuscular disorders, etc. There is not much scope of treatment. Then after that, I advise those who are willing to go for movement disorders that you should try to set up your own database. This is number one. There will not be any golden time where you will get all the opportunities, all funding, everyone will be there at place, and then you start your research. So you build up your database, you build up your video is one of the very important things. After appropriate consent, you take videos, and then you follow up your patients. Learn from the patients. And then this is the thing when in the first stage of your career, you identify a mentor. Okay. So in the first 5 or 6 years after you pass neurology, you identify a mentor and try to get a fellowship or a mentorship by someone whom you thought of working with. Then the second part of your career, when you've decided, see, not everyone will be fortunate to have a work in an institute or a teaching institute. Some maybe go for practice, etc. So keep abreast with the recent developments. Those who want to have a institute, want to join an institute or a teaching hospital, etc., then you form a team. And the mid part of your career is very important, where you need a good colleagues, peers, etc. And you build up your department, build up your specialty. And then the third part is gradually you try to groom whomever you think that who can continue with your visions and your missions. Okay. And then you have to let go. See, at a time will come when everyone has to give the credence to your juniors, credence to your colleagues, respect their ideas. So these things will be very important, because unless you do these, you after some time you will be just thrown away from your specialty. Suddenly you realize that no one to support, no one to look back, etc. So I think leadership is very important. So if somebody, I'll advise that they should go to the career development. Leadership skills are there. Okay, how to work with it is not only that you have to work with a neurologist. If you have a movement disorder specialty, you have to work with the allied health professionals. before that, the neurosurgeons, the psychiatrists, then allied health professional, the nursing staff, the psychologist, the physiotherapist. And if you have a team, you have to be the leader of that team. And it is the patients has to come through you. You have to monitor how they're seeing the patients. You have to discuss research contributions. You have to give credence to everyone. So building up a team is very important.
So the golden words from Professor Pramod Pal. Once again, thank you, Dr. Pal. It was a pleasure talking to you. Thank you very much. Thank you.